Welcome to Nurse Talk Live. I'm Alice Benjamin. And recently, OpenAI found itself in the center of debate over liability protections for AI developers, reigniting conversations about accountability as artificial intelligence becomes more integrated into everyday life. Now, for healthcare professionals, the conversation takes on an entirely different meaning. So, when AI gets it wrong, who's responsible? And what's nursing's role in all of AI? So, joining me is healthcare innovation leader and nurse Dr. Dan Weberg. Dan, welcome to the show.
Thank you.
All right, Dan. Now, so let's start with the bigger picture here. We're seeing growing debates around AI accountability, liability, and oversight. And at the center of this conversation are questions about who should be responsible when AI contributes to harm. So, for those who may not have been following the conversation or the story closely, can you give our listeners an idea of what's been happening and why healthcare professionals should be paying attention?
I mean, I think the issue really is if you have clinical decision support supported by machine learning and algorithms and data, when you make that clinical decision and it impacts a patient, who is going to be the accountable party if something goes wrong, like you mentioned? And I think, when in my conversations with both the tech side and the clinician side, the tech side, well, we're just providing insight for a clinician to make the decision. It's not on us. And on the clinician side, they're like, we don't have any training, nowhere in nursing school where we taught how to incorporate machine generated insights into our clinical decision making. And so we don't, it's on them. If they give us bad information, and we make a decision, it's on them. So I think that that's the debate that's going on. At the end of the day, the way I've framed it is, the machine isn't licensed and you are. And so at the end of the day, you're making a clinical judgment based on your licensed expertise. My opinion right now is the clinician's going to be held liable more so than the technology behind it.
No, I agree with you totally on that. And I'm just going to also kind of speak to some like personal practice issues. So in the electronic health record system that we use, AI is definitely doing its thing because as I pull up a patient's chart preparing for their visit, there's already a note of
Hmm.
like making recommendations to me, the nurse practitioner, the prescriber, the provider here as to kind of what I should do. And I
Hmm.
worry about that because sometimes I look at it, I'm like, huh, not too bad. Made my job pretty easy here.
Hmm.
And then sometimes I'm like, Lord help us.
Right.
We are in deep trouble here. But, as I think there's, it's good, but sometimes we don't know what we don't know. So we
Hmm.
don't know if this information isn't good. So I think that's where the conundrum is because it's helpful, but then when it's not, boy, are we in deep trouble? So, I don't think clinicians really even understand that how heavily AI is already integrated into our systems and practices now,
Yeah, I
right?
mean the summaries are a big piece of it. The ambient listening and charting that's out there is summarizing things, and we're trusting it. And I think the challenge we have right now because AI has spread so fast, and in the healthcare space, our clinician and decision makers haven't really been exposed to it from a fundamental like how this works standpoint. They've just been introduced to it as figure this thing out. Now it's your tool, trust it. And so when you don't understand how something works, you have two options. You can either blindly trust it or you can blindly reject it. Or you can spend time to learn more. And I feel like that's where we're at in nursing specifically. We're having nurses like AI is bad. We have people protesting AI. It's going to take our jobs. Then we have another camp that's like this is the way forward. AI will make our lives easier, and that 30% of a nurse's shift in hunting and gathering information is going to be removed, and we're going to have breaks and be able to have more time with our patients and do those value added things. And I think the industry in general has done a bad job about educating on how a clinician assesses an AI insight. And I think we have a lot of room to grow there. And until we get to the basics and understand the rationale behind why these suggestions or these summaries are coming up, I think we're going to still be in that camp of I'm either going to trust it because this is I come comfortable with that, or I'm going to reject it because it's just not making sense to my clinical brain.
Definitely been on both sides of the fence. Absolutely, I have. And I got to the point like, well, AI is not going anywhere.
Hmm.
And I don't even know if we always use the word AI. Some people, they think Chat GPT. Everyone's
Hmm.
familiar with Chat. Everything is Chat GPT or Claude
Hmm.
nowadays. But this type of technology, which is meant to, help us quickly gather information, help us with some early clinical insight, and maybe I use it as like I think of it as like these are prompts. Alice,
Hmm.
did you consider this? Did you
Yeah.
consider that? And rather than just to lean on it heavily,
Hmm.
but I say this. There are the people who are very tech savvy and understand all these things, like you mentioned. How do I assess to see if something is appropriate
Right.
information
Yeah, like
from?
yeah, it makes sense.
Yeah, does it make sense? And does it include all the information I need to? But then you have some of the people who are the most experienced with years and years of knowledge, expertise. They may not be the tech savvy folks.
Right.
So I feel like we have to kind of meet in the middle here, but
Hmm.
we're not. We're not there. So
Yeah.
I mean, how do we get develop a product that
Yeah.
we feel confident and safe in? How about that?
I mean, for me, I think I'm trying to frame AI right now as another source of evidence. So, we are taught the evidence-based practice process. We know how to appraise evidence, look through research, make sure that it's valid, do an evidence appraisal of a group of information, and then make a decision off of it. And I think we have to do the same with AI. So, it's those pillars of evidence-based practice. Does the evidence make sense? Can I verify that it's from a valid and reliable sources? Does it make sense clinically in my judgment and experience? Am I pulling that in? Does it work with the patient preference? Like that evidence based tool set, I think we can apply directly to these AI tools. Now, where the problem is right now, and it's getting better, but those AI tools can't tell you how it thinks. It can't tell you how it's connecting the dots. And sometimes when you ask it to reference something, it gives you a completely fake reference. And so I think that's where our gap is. But, for the naysayers, I use this slide in some of my talks, and it's like, AI has been blamed for biased decision making. AI has been blamed for privacy issues, for lack of transparency, and for hallucinations, making stuff up. And I said, well, how did we get information before AI? If you didn't know something, you went and asked the most experienced person on your unit. And they're biased because they only know what they know and their experience. Their privacy issue, they go in the break room and tell everybody how dumb of a question that was. They lack transparency. They can't cite the reference from the textbook or the article right in front of you to tell you that this is where they got it. And they definitely make stuff up to just fill in the gaps so they remain in their situation of being the most experienced or whatever. So AI does the same thing as what asking a friend it does. And so we can't just blame the machine over and over. We have to build a structure of how do you appraise this stuff. And I think the EBP sort of formula is a good way for us to start that.
That is actually a great point. I've never thought of it that way. And, obviously, with every major innovation, it brings both opportunity and
Mhm.
risk. And so, with that all out on the table, do you worry that healthcare organizations could become overly dependent on AI? And part two of that is how do we ensure the technology supports the clinical judgment rather than replaces it?
Yeah, I think there's a risk always to overly rely on it, and I think we still have the same issue with electronic medical records. When there's downtime, chaos ensues. You can't get the lab; it doesn't send the thing. You have to make phone calls and use the tube system again. Like it's the same. I think it's the same issue. Where I get worried is if we're giving up our decision making to the AI algorithms and we stop critically making decisions, then that's where I think we get that drift. And there's some science coming out about decision fatigue and losing your critical thinking if you're just relying on the output of the machine. So for me, for a good clinical tool set, and there's one from Mednition, it's called KDI, which I think they've done a good model, which is they suggest and they give you a confidence interval. So they're like, hey, nurse at triage in the emergency department, you rated them an ESI score 3, but based on our review of the chart and our AI system, we have a 50% chance that they should be a 2. Here's some key points on why they have a history of XYZ or they're on this medication. We think you should consider an ESI 2, and doesn't tell them to do it. It just serves it up in a way that the nurse can now consider that and use their clinical judgment to make the decision. And I think that's the kind of tools we have to have, because it's not taking the decision away, it's informing it with information you didn't have access to before. And if I think we do it that way, that puts the human in the loop and we keep that clinical expertise intact. If we're just like outsourcing all of our decision to AI, what's the point of having radiologists anymore? I mean, we could replace all of them with AI or nurses, utilization management nurses or case managers. Like that just doesn't seem like to me, it seems like the movie Idiocracy when they do the healthcare scene.
Well, you bring up a good point because that's actually some of open AI and kind of that tech sector's stance on the case of for protection. I believe they call it the human in the loop defense. So they state that they are not medical devices. They should not be used for diagnostic treatment or decisions without human oversight. So that is the human in the loop, having human oversight. And I think, but where things are moving so fast, Dan, like they're moving so
Hmm.
patients are sick. We're expected to be highly productive in an environment that we know the healthcare workplace is very toxic. Let's
Yeah.
just say that in a nutshell. And so we're expected to produce and, do all of these things. So to meet our metrics, to not get left behind, to not get written up for not being productive, we rely on these tools. And so even though we know that there are some concerns, I think a lot, I'm just going to go out on a limb.
Hmm.
I think more clinicians rely on it for clinical decision making than not. And it's because time's not on our side. We
Hmm.
don't have the hours of time to go searching and looking up for things. And we presume that if we're flooding the database for AI, ChatGPT and Claude with all of the research and all the papers, it should know better. It should know better. If I'm just saying, I'm not saying
Yeah.
any side is right, but so what's nursing's role in this? What should we as nurse as the largest segment of the healthcare workforce, what's our responsibility with, as we say to the patients, we have roles and we have responsibilities. What are
Yeah.
those for nurses?
Yeah, I think, from a role perspective, I think nurses need to be building these tools with the developers. I think, and I hate the words get a seat at the table. Like we should bring the table and they should have a seat at our table, honestly. But I think that we need to be informing this stuff. And what I find with a lot of the tech companies when they start up, it's tech people that came from another industry and want to get into the big market share that healthcare has, don't have any clinical experience, go right for the physician as their expert, and then are building nursing workflows. And I've seen that in large tech companies. I've seen that in the startups, and I think that needs to change. So getting us out there, out of our bedside mindset, and going and informing these companies on how they build their tools, I think is key. Having a nurse in a senior leadership position. So I think that's a role we need to play. Our responsibility is to protect our patients and our license and our profession. And I think there's been some good legislation in Oregon saying that an AI tool cannot be called a nurse. A nurse is a licensed human professional. And I think it's our responsibility to continue to protect our work and our license in that way, not reject AI or stop AI, but to protect what nursing is and allow it to be informed by these new technologies, not replaced by it. And I think that's our responsibility as a profession to continue to advocate for that. And if a tool is coming in, and we're seeing this with some of the union contracts now, I think New York has it. I know some folks in California have started putting this into their contracts, creating AI kind of advisory boards where the nurses are informed that a tool's coming. It's not just showing up on health Epic and what on the next day. There's actually some diligence from the clinical teams to say, how is this going to work in our workflow? Do we trust it? What's the back end data? And then I think the third piece is we have to inform ourselves, take individual responsibility to understand this new technology and its implications for us, and build structures for that to happen. Whether that's annual education for our nurses already out on the floor, or build in a nursing school, or have continuing education courses where we can kind of get to the meat of this enough where we can assess it and decide how we're going to incorporate it in our day to day. So I think that's sort of my take on it.
They say there's a nursing shortage out there, Dan. That's what they say,
Hmm.
right? And one could argue as to why, and especially in certain places and regions and specialties. But it sounds like yes, we do need nurses at the table, working with the developers for the technology. We also need more nurse educators, right?
Hmm.
Teaching all this stuff. We also need kind of a quality system in place to make sure, like, okay, we're using all of this AI technology. A third party, go out, just let's do some random case reviews and look to make sure everything was done the proper way. I'm not sure we have enough people, manpower,
To
to
do
do
all
those things.
that.
So where do they come from? And yeah, where do they come from? And then two, let's say you're a nurse listening. We have a bedside nurse listening. They're like, you know what? I would like to pursue that career. How do I
Hmm.
even get into that?
Yeah, great question. So I think this is where the marriage of nursing and AI come together. And I think about education and how inefficient education is, right? Everyone comes in, you get a lecture, it's been the lecture for 10 million years, it's been a PowerPoint, there's no active learning, the faculty are stressed because they have to build more content. AI is great at that. So, for me, from an education standpoint, I think that faculty need to start becoming context experts and not so much be building the PowerPoint of the anatomy of the heart anymore, because the tools can build that. Like, that's a known thing. You can generate content really easily now using these tools, using your expertise as faculty. go through it, make sure it's right, and then you're done. Now you can talk about context. So I think we can actually improve the workflow of education, not do more with less, but actually make it more efficient so that we can have the people use the resources we have to train the people that we need. From the workforce perspective, I think there's an opportunity for us to really sort of schedule differently and think about being more efficient in staffing and those type of things. Again, AI algorithms are really good at placing the right thing in the right order. And so can we get more efficient so we can free people up to be able to learn these things, right? And not force 20 hours of overtime and then go to your meeting and annual education on top of that. And then I think the governance piece is big. All of these are new jobs, by the way, and nursing is such positioned to be in these roles, in the leading AI education, in developing new workforce tools, and being those quality oversights of the tools when they're deployed. That's what nurses do every single day. And so I see this as a growth for nursing. And hopefully, if we can free up time and that sort of wasted work that is embedded in our day, then we don't need more. We can just be more efficient with what we have.
I like that. Work smarter, not harder. I'm all
Mm-hmm.
for that. Dan, for nurses who are interested in innovation, technology, and kind of this healthcare transformation, where do you recommend that they begin?
Yeah. So there's a couple really good things that are nurse specific. So I would start with American Nurses Association. They have an AI ethics white paper out. The Academy of Nursing also American Academy of Nursing also has that. So I'd start there. Start reading about some of the policies and white papers that our associations have put out around the tools. That kind of gives you a good background of our ethical responsibility and how it's tied into the profession. There's some really good free courses out there too. Some built by nurses, some built by Google, some built by other companies around educating healthcare AI. LinkedIn Learning has some stuff. There's just a lot of great tools out there. So go pick an easy one, an intro to AI, and just play around with it. You already have access to these tools. If you have Gmail, you already have Gemini in your system. Like go play with it and ask it questions and try and break it. Like I think it's that innovation life cycle of test it, break it, play with it in a non-stressed environment so that you can see some of the issues, then you can bring it to how people move forward. And then there's if you go, I mean, I think LinkedIn's a great tool to go network, but there's groups out there. There's AI groups in nursing that are trying to get consortiums together to talk about this. There's nurses working in startups that are trying to get out and look at these things. And there's some courses coming out soon from some of our academic partners that have partnered with AI companies to educate on AI specifically for nursing. So I would say take a look at those pieces. It's an easy Google search, and I can give you some to put in the show notes too. There's some really good tools out there, and just start playing with it because ignorance is going to make a risk for you. At least get exposed and play around with it, and then you can have an informed decision as it moves forward.
Exactly, because the train has left the station.
This
It's
train's left
just
the
a matter of
station. It's not stopping.
it's not stopping. Got to get on there. Now, as we close, if there was one thing you wanted nurses to understand about AI right now, what would that be?
I would say there's a really good article that Olga Yokasheva wrote in Nursing Economics. And I think one of the fears I hear all over the country is AI is going to take nursing's job. And she did a really good job of mapping out the work of nurses and what AI is good at. And the work of nurses is not what AI is good at. And so our jobs are safe. So that's the point. Their jobs are safe, but the nurses that don't incorporate AI may not be. So understand how this tool can support you, give you a superpower, and don't worry about it replacing you. It's not there yet. And get informed and make it your superpower. I really think this tool is our superpower to take that burden of extra work and stress and running around with our hair on fire every day, and make nursing joyful again.
I like that. That's leaving on a positive and realistic note. It is,
Mm-hmm.
and I actually hear a lot of great job opportunities to actually make our profession even better because so much we're associated with just taking care of patients, and that's an important job. But
Mm-hmm.
we actually do a lot for the actual healthcare workforce in totality. So
Yep.
thanks so much for the information. I mean. Artificial intelligence may change how healthcare is delivered, but accountability, compassion, and clinical judgment still remains with the human responsibility. And we see that there's tons of opportunities for nursing in this. Many thanks to Dr. Dan Weberg for joining us today for Nurse Talk Live. I'm Nurse Alice. See you next time.